This is the 9th annual conference sponsored by the Governor's Committee to End Homelessness, and we are glad you're here. We especially want to thank Mercy Neighborhood Services for being our lead sponsor of this, because without their support, you would not be sitting there for free. That's just the way it is. We would have to charge for this conference, and we all know how that goes. And so we're very thankful to them for allowing us to be here today and to be part of this event. Yes. I was speaking to a group of social work students last week, and we were talking about homelessness, and it became very evident that, they had a book learning, a media learning, an experience of what homelessness meant without ever actually talking to anyone who had ever been homeless, actually ever interacting with anyone who had had those challenges in their life. And I find that a lot. I find that when I speak to groups about homelessness and in my own journey of understanding the issues around homelessness, that we have formed a lot of opinions and we think we know a lot of things, but we don't always really understand them. 15 years ago, my agency didn't really do anything with homelessness, so to speak. We had programs for people in poverty. We had programs for people that were losing housing or threatened with eviction. We had food pantries. We had all kinds of other things. But we didn't really deal with those that were on the street and homeless and living without any shelter. And through a series of events where my boss went to meetings without the rest of us, we got kind of dragged into working with chronically homeless men. The faith community asked us to step forward, and we did. And we found ourselves not really knowing what to expect, not really knowing what we were getting into. I often joke that we eventually ran a cold weather shelter, and out of that have come two buildings that house chronically homeless men in our community that we operate, and a whole separate corporate entity from our original corporate entity. And I often joke that all of that was the result of zero strategic planning. In fact, I think that if you'd have asked our board at the time to vote with the little dots on things we should do, no one would have voted for us to take this on, because it wasn't our mission. It wasn't what we were typically doing. And I go back to a night close to 15 years ago now, where we had opened our cold weather shelter in a loaned space where we'd have to set up and tear down every evening and every morning, because they ran a food kitchen in it during the lunch hour. And we had these men coming in off the streets that we had never interacted with, and they were staying there. And I was sitting there with a volunteer who would later become our county commissioner, and we were playing cards with 3 or 4 of the men that were staying in the shelter that night, who were homeless. And at first glance, the kid that sat down, I can say kid because I'm old now, I was like, well, why is he here? He appears to be fairly with it. He appears fairly clean shaven. He doesn't fit my preconception of what the people that are coming in the door to sleep here should look like. So I was a little confused. So we began to play cards, and it didn't take too long into our card game as the conversation went, where I began to understand why he was probably sleeping in our shelter that night. The evidence of mental illness, the evidence of confusion, the evidence of possible substance abuse issues in his past and probably present, some bad family dynamics, all those things together had led him to this path where he was on the street. And now, as I've done this for a while, and as I talk to mostly men, because that's who I deal with a lot, as I talk to them, I find that their paths are all very different to wind up living without shelter. And so when people ask me, well, why do people become homeless? I have to tell them there's no one easy answer there. There's no one path. There's no one demographic that I can show you that says that's why people wind up on the street. There are many paths that bring people to this place that we don't really think is a good place for them to be. And there are many paths that they can take out of homelessness, and that's what we're here about today. How do we, as providers, as people in the state who are interested in the issues of homelessness, how do we help the people we serve? This conference has been going on for 9 years. In the last couple of years, we've changed the focus a bit, and we hope that today and tomorrow you will have the chance to network with each other, the chance to hear presentations, the chance to gain knowledge about what it is you do when you go back to wherever you're from and deal with those who are homeless and in danger of losing their home, and those who are facing all the issues that surround homelessness in this state and this nation. I also want to thank you because you do really good work. The Governor's Committee does pay attention to all the things that go on in the state as best we can, and we talk about the good work that is done in your programs across this state, housing people, getting people off the street, helping them rebuild their lives, helping them reconnect with their families, helping them in any number of ways to make a difference. So thank you for being here. Thank you for doing what you do. I hope that you can take away from today a lot of good stuff. Without further ado, I would like to introduce Jennifer Tidwell. Most of you know her. She worked for MHDC for a long time, and then last year at this time became the regional administrator for Region 7 of HUD, which is Iowa, Kansas, Missouri, and Nebraska. She's been in housing and real estate for over 20 years, and she was the Deputy Director of Public Policy for MHDC. And we would like to welcome her, and we're just glad she's here, so thank you.
Thank you, Randy. Good morning, and thank you all for inviting me here today. I want to express my appreciation to all of you who work so hard for those in need of affordable housing and homeless population, which includes veterans, families, and individuals that need our help. Each of you and the organizations you represent are absolutely essential in creating the environment to end homelessness. HUD's commitment and its leadership as it relates to homelessness remains strong, passionate, and firmly dedicated to working with you to end homelessness. Secretary Castro's vision includes improving the way we do business, focusing on outcomes. HUD is your partner, bringing opportunity whenever possible. Ensuring that everyone can obtain and maintain access to housing remains our top priority. We have systematically increased collaboration with agencies like the Veterans Administration and the Health and Human Services to better serve our communities around Missouri. We are using data to determine what is working and what's not, which is guiding us to a more targeted approach to assist those in need. This year, the Continuum of Care community across the state of Missouri was awarded about $28.6 million for 120 housing programs and service programs across the state. Just last month, HUD released its 2014 Annual Homeless Assessment Report. I am pleased to announce that homelessness in Missouri was decreased by 10% since 2010. All that is because of you guys that are working hard out in our communities. The success in Missouri and your commitment to 100,000 home campaigns, Housing First opportunities, and now Zero 2016 is making a difference. Mayors in the region have been taking on the task of ending veterans' homelessness by creating one-stop shop events, pushing the cities to think more broadly about the needs of veterans in a coordinated way. Zero 2016 is designed to help communities follow best practices and how to cooperate to include those practices into our everyday work. Communities will be involved in hands-on coaching, the implementation of transparent data, and performance strategies using a shared learning environment. The campaign is generating continued momentum around homelessness. My mission today is to let you know we are here to assist and to be a more effective partner. I welcome your feedback to let us know how we can serve you better. Many of you have been working on homeless issues for years, some decades like myself. We sincerely appreciate the work you do every day to help the most vulnerable of us. Bell Hooks in 1993 said, "Where is the healing place?" Now I am more confident than ever that community is the healing place. The experience of community is crucial to our wellness. We all need to participate in that space as partners. Thank you again for the opportunity to talk to you today. I also have the pleasure to introduce Dr. Fowler today. Dr. Fowler's research aims to inform developmentally sensitive public and programmatic policy that supports at-risk families. The work applies rigorous methodology to understand the mechanisms through which housing stabilization promotes healthy child development. Recent research conducted by Dr. Fowler focuses on interagency coordination between the child welfare, public housing, and homeless service supports to support precariously housed youth and families. One ongoing study funded by the National Institute of Child Health and Welfare tests the impact of connecting families who are inadequately housed threatens out-of-home placement to affordable housing. Dr. Fowler's work uses innovative methods to investigate the association of housing instability and emotional behavior and educational outcomes. Dr. Fowler joined the faculty of the Brown School in January of 2013. He also serves as the affiliated faculty in the Clinical and Community Psychology program at DePaul University in Chicago. Dr. Fowler teaches courses on program evaluation and developmental psychopathology. He will present on coordinated housing, homeless, and child welfare services to support healthy families and children. Please give Dr. Fowler a warm welcome.
Good afternoon. Can you hear me? Yes. I've been accused of being a soft talker. If I get too soft, let me know. I am very honored to be here. This is a true pleasure. Randy said that he likes to start with something that captures the audience. I realized I have nothing, so look up the cat pictures. Today, I have to put this up every time I talk. This is the disclaimer from NIH, who funded much of this research. If you like this, they paid for it. If you don't, it's not their work. So today, I've got kind of three big overarching themes. And I don't have the computer in front of me, so I'm going to be looking at multiple screens as well. So the first is to present an argument that too many families from the child welfare system are ending up homeless. And I want to show the evidence that we've accumulated about that. I also want to show the impact of not doing anything about that. Then I'm going to talk about what exists and what we're looking at to mitigate some of this. And I want to finish by talking about, well, why should we care in Missouri? I am relatively new to Missouri. Most of my work is national and in Chicago, but we have a lot of opportunities here. So, okay. Who knows Dasani? This is a wonderful project done by the New York Times about a young, she started as a young girl. She was 11 when she started this project, and they followed her for about a little less than a year. A girl who is living in homeless shelters in New York. The article goes into really the true resilience that we see in homeless children. And that's kind of where I started too. So I am by training a child psychologist. I am a clinical psychologist. I did my training in Detroit. Anybody from Detroit? Good. I can talk about them. What I quickly learned in trying to be a psychologist in a homeless shelter is mental health isn't the number one priority. And it was a true struggle to make progress towards better family functioning, better parenting, better child behavior, better emotional health. There were so many challenges. And that's where I started. I also did a lot of work with homeless adolescents, and my pull into child welfare was just talking to too many youth who said, oh yeah, I was in the child welfare system. I'm running away right now from a placement, or I ended up on the streets when I switched to my new foster home. And then talking to adults and hearing kind of the same story. This got me thinking, and it has guided my research. The framework that I use is it's called a developmental approach, but it makes sense. So homelessness is not the only thing that challenges children in shelters. Often it's a number of barriers. There's family problems, there's mental illness in parents, there's mental illness in the community. There's a lot going on. And these stresses add up. What we see in brain science is you get away with a few. You get away with a few stressors, but as you progress, your brain just can't shield, it can't protect. Research done in a large study shows just kind of, so can you hear me?
Yeah.
Sort of. So this is the percent of children with some developmental delay, either emotional, social, cognitive, and this is the number of risk factors they've experienced in their lifetime. 1 to 2, okay. 3, 4, by the time you get to 7, your chances of having a developmental delay are almost 100%. We call this toxic stress. So it is changing the way brains develop, and these have life course implications. My work really focuses on building an evidence. I truly believe that we can change the course of children's lives and the course of families. To do that requires, in the picture you see, these are parents, these are adults. It requires each of us to start tackling some of the big barriers. It also requires some planning. How are we going to best coordinate our efforts? So that really is the focus of my work. The other piece of this is I have quickly realized that, do we have any politicians in the room? Good. Policymakers, they listen to numbers. So developing numbers and accumulating some good solid research can go a long way with shaping the future. So child welfare and housing are two separate systems, similar to the corn, wheat, and missile silos. They don't cross very often. There are many reasons. Do we have any child welfare folks in the room? Oh, that's too bad. We got one? All right. And I think these are going, so this is research that we've done with child welfare workers. So why is it challenging to work with homeless families? Well, we don't have any services. We don't know what to do. We have a lot of cases. In Illinois, average caseload is probably 36 to 1 caseworker, which is very, very high. There are very few resources within the child welfare system to address housing. Most of them are things like having a list of homeless shelters, a list of phone numbers. They are soft touch services. And kind of just more generally, we don't really know how to help these families. We don't have a strong evidence base yet on what works. So that's the goal of my research. Framing this research, it's, well, what do we need to know? This is completely exhausting my capabilities of PowerPoint. This was the hardest part of making this presentation. Getting that water to move required too long, and I'm not willing to. YouTube is a wonderful thing. So what we need to know. So the way that I frame this, the metaphor that comes to my head is that these two systems are bathtubs. They have their own pools of water. They have their own populations, and we're seeing seepage from one to the other. So people are coming into contact with the child welfare system, and they're ending up in the homeless system, and then maybe back into the child welfare system. So we need to, one thing we need to know is what is the water level of the number of families in the child welfare system who experience housing problems. That's just kind of a basic first step. If we don't know that, we don't know how big of a response we need. We won't know if we're making progress on reducing those numbers. So we need just, what's the water threshold? What's the water table? And we need to know how to stop the flow. So that's the really important part. And in my mind, the best way to do this would be upstream. So how can we slow down the flow of families coming into the child welfare system with housing problems that are ending up homeless by going very far upstream? What can we provide at the very beginning? And this is to keep families safe, stable, and to promote the development of children. Again, we've got to start knocking down some of those stressors. So this is my frame. That also required way too much time. That's me turning that handle. So can we slow that flow? Did I turn the water off? Yeah, I turned the water off. Yay! I was going to drain the bathtubs, but then So that's what we've got two big agendas. Get the water level, see how we can reduce that water level. What do we know so far? So again, policymakers like numbers, and some of them like special numbers, like prevalence rates and population and samples and lots of researchy stuff. We go to the source. There's a huge hallmark study of children involved in the child welfare system, the National Survey of Child Adolescent Wellbeing. This is the budget, it's at least $25 million, funded over from 1999. They just actually ended data collection. This is a huge study of over 11,000 families who have been involved in the child welfare system. It's a representative sample of families in the child welfare system. It's a big, nice study. They don't ask about homelessness. So this is a multi-wave, multi-year, multi-informant study. They talk to caseworkers, they talk to caregivers, they talk to children. There is very scant attention to housing. We can fix that. So some of my work has been using kind of advanced statistics to get around what the water level would be. And it's manageable, I think. So the child welfare system kind of has two arms. The first arm is to screen families who've been reported for possible maltreatment. And then the kind of second arm is to use out-of-home placement to protect those children. When we look at the first arm, 1 out of every 6 families who are investigated experience some housing problem that threatens out-of-home placement of the child. 1 in 6. That's a lot, but manageable. We're talking hundreds of thousands of kids every year. There's 350,000 investigations for child maltreatment annually. So 1 out of every 6 of those have a housing problem that are making it hard for the family to keep their kids. When we look at the second arm, when we look at parents who are working towards getting their children back in the home, maybe they're going to treatment, maybe they're going to in recovery, maybe they're looking for jobs, maybe they're looking for housing, that number jumps up a lot. So at least 40% of those women, and mostly women, 80% women in this sample, are experiencing some housing that delays placement. And in child welfare, you hear this all the time. I want to get this kid back into this house so bad, but the mom's living in a hotel. And I don't feel like I can make an argument that the child's safe. Meanwhile, the child is separated from his parent. And that challenges the well-being of the child. So this is when I'm thinking of that bathtub, this is a pretty heavy flow. What we also know is that there's 2 spouts. There's families coming into the child welfare system, and there's adolescents leaving the system. When I did my work in Detroit, we found that 48% of youth who had aged out of foster care experienced homelessness within the 2 years after leaving the system. 1 out of every other kid would experience some episode of homelessness. Detroit is a very hard housing market. When we look at this nationally, we see 18% of kids will experience literal homelessness. That is, they are living in a shelter, on the streets, in basic standard definition of homeless used by HUD. What I think is as equally troubling is the kids who bounce around, the couch surfers. So a third, essentially, 1 out of 3 of youth aging out of foster care across the country do 3 or more housing situations within a year. That's a lot of movement. That's way higher than that age range. And those kids, a good chunk of those kids will stay homeless. They're the folks who you'll see in shelters longer in the future. So we know what the number is in terms of people, but what about the impact on people? What does this do to kids? Our research shows really heavy effects on, in particular, behavior problems. Youth who move around a lot in the child welfare system are put on a different developmental course, one that is fraught with acting out, leads to truancy, leads to heavy-hitting problems. And this is especially true when they experience it when they're young and when they're older. So it was preschoolers and adolescents who show these problems. There is a timing effect of these housing problems, which is interesting for programs. What I think is especially troubling is that children who experience housing instability show poorer growth on cognitive tasks. That's verbal and nonverbal skills. These are the building blocks of a successful career. These are the things that you need to know to get and keep a job. And we're seeing some really troubling effects. And that thing about older and younger kids, it doesn't matter. All kids suffer this. So this, I think, is a true argument to do something. Oh, and just, that's a neuron. That's the rest of your body. What we're really seeing in brain science is that your brain is changing in reaction to your body. You're overwhelmed with stress, and it's changing your brain. And a really kind of simple way to put it is, you know how you get anxious? And sometimes you're really anxious? If you continue that, it won't shut off. And what that does is damage the brain so that it's triggered without reason and it has trouble turning off. So you see this kind of hypervigilance, which is a very serious, it's a public health issue. This is problematic. Okay, so what do we know? Using that national data, looking at what services were provided to families within the child welfare system, at a national level, housing services provided to child welfare families doesn't help. Families who received services were not more likely or less likely to become homeless. They were not more likely or less likely to have their children removed. And in fact, it went the other way. Families who received housing services in the child welfare system were more likely to experience homelessness, and they were more likely to have their children placed out of home. We see this, so folks have called this the fishbowl effect, where family gets pulled into the child welfare system and everybody's watching. So this is occurring, and it's occurring on a national level. Why don't these things work? Well, I've already said that a lot of the services were very light touches. If you were lucky, it was first month's rent. But most likely, it was referrals for furniture or referrals to the local homeless shelter. There is not a lot of coordinated response. So, would a heavier hitter work? If we provided housing to these families who are at very high risk, would it keep the kids safe, stable, and ready to grow? This is our next question. This is the Family Unification Program is a long-standing program sponsored by HUD that really focuses on partnering child welfare agencies with local housing authorities. Again, these are two silos that don't talk. So this is an initiative to get those silos to talk. The program has a very unfortunate acronym. The first time that I explained and talked about the program, I used the acronym just out of shorthand. That's how I use it. And I heard in the crowd, "Oh my Lord." So I am going to try to not use the acronym, but if I slip, I didn't say that. Okay, so the way the program works, it essentially releases vouchers that are immediately used for families in the child welfare system. So it's in essence for in many places, it is a bump to the top of the Section 8 housing voucher list. Families are identified by child welfare. They get a referral to the Public Housing Authority to sign up for Section 8. They have to meet all the eligibility required for Section 8. They have to show up for the appointment. But it's a chance. So just to point out, so it's been around for a long time. Enacted by George Bush, actually pushed by Senator Kit Bond. He was a big advocate of the program. There are, since 1990, this map is showing kind of the places where we've distributed these vouchers. There are 20,000 vouchers made available to child welfare involved families across the country. There are some places that have gotten more than others. The largest is in Chicago. They currently have 600 vouchers in their system. St. Louis had 3, but they lost it. Any St. Louis people? Yeah, they're not sure where they went. They used to have the program, but then it got just rolled into the plain Section 8 program. So the question is this enough? So essentially, this intervention is a permanent housing intervention. It's providing families with a Section 8 voucher. This is the kind of intervention that we think we need. And to make the case for scaling this up, we need the numbers. We need to show that policymakers really want to know, how much money am I saving? How much money are we investing? How much money do we receive from not spending it in child welfare, not spending it in homeless services, not spending it in remedial education, not spending it in the criminal justice system? Those are the kinds of things that we need to collect. And the basic question is, does this program keep families together? Does it keep them housed and together? We think it does, but we need to get the numbers for policymakers. We went to Chicago. Well, I was in Chicago. Chicago, like I said, it's the largest site of the Family Unification Program. They also have a wait list for Section 8 that so in 30 days, 200,000 people signed up for Section 8. They took a random sample of 60,000 of those people, gave them a lottery number, I think, and people have waited since 2008. Projections say you could wait for 40 years and never get a voucher. It's a huge demand. Housing is a huge demand. Just to point out, St. Louis Housing Authority, just opened their wait list. They, in 5 days, received 47,000 applications. They have what really equates to about 200 maybe vouchers a year. So again, it's a 40-year wait. We want to really make sure this program works because we don't want families who could benefit more receiving this heavy intervention when there's so many other needy families. And something to point out, so this is the Family Unification Program is for child welfare involved families. If the family loses the child, they keep the voucher. So there is a high risk, high reward. What we did for our study, and this is again for the policymakers, we took advantage of that huge wait list, and we used their lottery to pick families who would get the voucher. So that's called a natural experiment. We're not denying services for anybody. In fact, we're probably making it more fair. Before we implemented this, it really was how loud of a caseworker do you have determined whether you got onto the program or not. So this made it into a lottery. So the question is, does it work? This is a graph for the policymakers, but I think it helps. This axis, the up and down, is percent of families who experienced homelessness. This is time. 0 is when the family was referred to the program, and we followed them for 12 months. So, what we expect is families who, there's the acronym, if you couldn't do it in your head. We expected families in the intervention group to experience considerably less homelessness over time. That's when families were referred to the program. This is what we see. This is evidence that the program does work. So families who received the intervention were significantly less likely to experience homelessness over time. That dashed line is the average time that it took to get a voucher. So it took about 5 months to get a voucher. So we see the benefits when we expected to see the benefits. I also see maybe some positive, that a lot of the families who didn't get the benefits, who got a lighter touch intervention, also avoided homelessness. So this is really important information. Just to point out, that's a big difference, and that's the difference that we'll show to policymakers. Next question is, does the program keep families together? Not yet. So the 2 bars are families in the treatment group and families in the control group. There's no difference on whether or not you had your kid placed into out-of-home care 12 months later, 10 months later. This is, I say, there's no difference yet. These families, what we expect is to see more improvements over time. And fortunately, this is a 5-year study. So we get to measure these families for over about 3 years, and we get to talk to the kids. And that's kind of where I'm most interested. So does the program help those kids? We don't know yet, but we will know. We've measured all sorts of things on the kids to see if they are actually put on more healthy developmental trajectories. Because that's the real goal. That's the real goal of child welfare, and that's the real goal of the, we want to promote healthy development. But a question remains. So we know light touch would be hard. We think permanent housing is very helpful, but is that enough? So there are other programs being tested. There's a handful in the country, there's 7 in the country, that focus on supportive housing models. So these are wraparound services for families, plus access to housing. These are even more expensive interventions. The question is, do we need that? Another route that we've been talking with, we know how to make parents better parents. We know through interventions in the child welfare system how to teach skills and how to set up families for success. Maybe that's enough. So we're working on that too. When we're thinking about removing barriers and blocks, it's a policy issue. So I've talked a lot about policymakers, and what we hope is to frame more effective policy at the national and local level. We just received a grant from the ACF, Administration for Children and Families. It's a grant to learn lessons. So we know who's doing work across the country. Some of those places are gathering data, And we are going to use that data to inform policy. We are bringing many people to the table. So we're talking to policymakers, we're talking to administrators, we're talking to service providers, and we're talking to them across the country. So we can learn a lot from what has been effective locally. But why do you care? To bring this back, there are not great data on Missouri specifically, looking at the intersection between child welfare and housing. Missouri has been a champion in certain aspects of the child welfare system. Missouri allows most youth, if they're doing the right things, to stay in the foster care system after the age of 18. That is a big deal. That's a really big deal. We know that 18 is a really high-risk period for homelessness, especially when leaving institutions. Missouri took the right action of extending that till 21. That said, we still need to get some sense of scope and programs. Just like the national idea, we need to do this locally. Just pulling on what's available. So what we know is using the point-in-time counts data that family homelessness is rising and has been rising with a big dip more recently in Missouri. So it's about 4,000 families who experience homelessness in the point-in-time count. We also know, just to point out, that the percentage of families comprising the homeless population in Missouri has not changed. It continues to be around 45%. So families are a huge chunk of the homeless population in Missouri. This is a key issue. Something to point out, national numbers suggest that homelessness has declined over time. Missouri has kind of caught up to the national rate. So the red line is the national trend on family homelessness up until 2013. In Missouri, we're just catching up, and I'm not sure how to explain that. We all know that the point-in-time count does not count all homeless, obviously. When you look at the student data, the unduplicated, so kids who were identified as homeless across the state who were not in shelters comprise the great bulk of the population, and that's also jumping very fast. That's a really fast rate of change. This is an issue. Family homelessness is an issue. So family unification program, we've got 236 vouchers across the state. Who's from Joplin? Yeah. Kansas City, you've got 55. St. Louis County, you've got the most at 178. If we just do the back of the envelope math, this is not enough. This is not enough of this program to go around. So we've got 256 vouchers in the state. If we just think about 1 in 6 families in contact with child welfare will experience some housing problem that threatens out-of-home placement. There are close to 9,000 families in the state of Missouri, and another 2,500 of families working towards reunification. The 256 is a drop in the bucket. What that means, resources are scarce, as they always are, as they always will be, as they are everywhere. But with scarcity comes opportunity. We have a lot of opportunities to learn what has been working locally and what has been working nationally, and trying stuff. Innovation is required. I think a huge challenge is, and I'm preaching to the choir, is this kind of triage. Who needs the heaviest hitting interventions the most? And how do we identify those folks? And how do we get them the services they need quickly? Those are the big questions. Those are very hard to answer, but we can do it. We do have some innovative methods. We are really looking forward to this. So we're working with the St. Louis Continuum of Care about their programming. This isn't easy, but there's plenty of opportunity. Did you get any good cat pictures out? So, questions? Yes.
I read an article about Utah and how they're solving their homelessness problem by simply putting everyone in housing and still saving money by not having people go to jail and, not being sick and going to the emergency room, and they're coming out financially. And I just wondered if we studied what they were doing, if they work in our state.
Yeah, that's a great question. The need in Utah is smaller than the need in many parts of Missouri. So it's a much larger investment. But that doesn't mean we shouldn't go that way. If that's what works and that's what will save us money in the long run, then we need to start building the evidence for that. So we're doing a couple of projects. One of them is looking at the frequent flyers in emergency departments in St. Louis. So it's the folks who can't hear me.
I told you I was a soft talker.
So the question was, why don't we just house people? It's worked in other places like Utah. Why don't we do it here? There is a difference with Utah. Just the numbers are larger here. So it would be a much larger investment. But those are the kinds of arguments that we need to make. Some work that we're doing in St. Louis, it's actually with the healthcare network in St. Louis, the health insurance. They're interested in the people who they are paying the most because they keep going to the emergency room. And those people happen to end up into the homeless shelters. So we're providing some cost estimates of how much you would save if you just gave that person housing. And we're doing the best that we can. We're doing a realistic cost estimate. Because what you don't want to do is give them a number. Oh, you'll save $46 for every dollar invested, and then you actually lose $46. That would be counterproductive. So we're thinking through this very closely.
Is it true that there's more house vacancies in America than there are homeless people?
Is that true? Let's get a show of hands. More house vacancies in America than homeless people. Is it? We got a couple maybes.
Can we qualify that? Kansas City has looked at their empty houses,
Yeah.
but out of approximately 1,600 empty houses, less than 215 of them could be brought up to code for safety and habitability because of the changes. Lead paint, asbestos, to name just a couple.
Or being able to pay utilities.
Paying utilities, yeah. So that there is no comparability between empty houses and homeless people. The second thing, in addition to lead, utilities, and asbestos, is that there are more high-dollar homes vacant in the suburbs, usually. And that is not the place for a homeless person to go and receive support. That is one of those myths, that we have empty houses, why not just put people in them? Because it doesn't work that way. Any more than saying a car along the highway could be given to a family to be a perfect solution to their transportation problem. It's I guess non sequitur is not exactly the right word, but it's a mythical thing to suggest as a remedy to homelessness. It is just completely a mythical thing to suggest.
Yeah, so the response was, there are a lot of vacant houses, and a lot of them can't be used. And there would be barriers to getting people into them. One of them would be people choosing to live there. And it could work. It could work for some, but it would be a drop in the bucket. It's not a long-term solution.
We know the effects that homelessness has on the brain development of the child and all the stressors. Why do you not include schools homeless clinics? I mean, this has been so frustrating to me.
Yeah.
So the question is, if this is impacting kids so much, why don't we look at the school data more closely? I agree. I absolutely agree. And schools are, so when I think about, I could add another bathtub. So child welfare would be one bathtub. Schools is another huge bathtub. And that's an opportunity. That's where we can catch families.
I want to add a read that. I haven't heard you say anything about it. I'm sure you may have said something about income. And contrary to what you think about the homeless, this data is based upon Restart. I hope we have some big picture from Restart today. Over a period of 7 years, I did income taxes as a volunteer, non-scientifically, except I did work with the subcommittee of the Missouri legislature, Stuart Whitney and the mayor at that time. And we did send this data on to the subcommittee in Congress. But I never did hear the follow-up. What I found was within of about 80 people with whom I did income tax, who were long-term homeless, in more than 1 year. The average income, this is circa 1997 income, so you can extrapolate what you want. The cost of the minimum wage hasn't gone up that much since 97, I don't think. The average homeless person at Project Restart, 918 East 9th Street, actually made $9,800 based upon W-2 forms submitted for refund. Those people, for the most part, were eligible for all kinds of government benefits, EIC being one, earned income credit. What I found was that that did not have, there were many others, like those that I talk about at the end of 50 years old, that had income, but they kept moving, so the W-2 forms never could catch up with it. Therefore, they didn't have family. Family was broken, family wouldn't be here. So I could not submit the W-2. I think about the 1040s, and I've been able to get around that, figure out some way to get it. There is a way of doing that, and I'm sure everybody here knows that. There is a way of getting those W-2 forms. If you just keep moving, and it gets mailed out, by the past for yours, and but I think sometimes people really don't understand the stigma issue of the homeless. Right. They are, for the most part, employed off and on. They're not employed every day like a professor or university is, but they're definitely employed. They just don't stay one place for a long time, and they move and they're transient, et cetera, et cetera.
Right.
So the comment is about one of the vicious cycles of homelessness. It's hard to connect with resources because you're moving, so you're not getting resources, and you're not getting resources, so you're not getting out of homeless. Yeah, and income is one. Yeah.
Yes, one, I read this and I was wondering, I have a couple of questions. It does not include Kansas City or St. Louis in this document. And so.
What is that?
This is the Missouri Balance of State Continuum of Care. So it's no data, and so if somebody has this data, I would like to get that. But my other question is, I'm from Kansas City, and I have worked with homeless youth particularly for over 20 years. And when I see up there 55 vouchers, I want to know how 55 vouchers could be given out. And I've worked with Kansas City School District, and we have averaged 1,700 students a year in the school district of homelessness. So I don't know how 55 vouchers can be given out. And then the next one is, someone asked about education of children. One of the poor examples that I have of students who are homeless, a lot of our homeless students are initially pulled from their houses and placed in foster care. Then they're pulled from the school because that's not the community the foster family is in. They're pulled from their friends, the support systems they have in school end immediately, extracurricular activities that they may be in. And they're no longer even allowed to attend the church that they have attended in their community. So this adds on to the continued stress of that child. And now I'm beginning to see, through my 20 years, third generation of families that are homeless.
Yeah, another vicious cycle. So Kansas City data are somewhere in that report. Oh, balance of state. That's the balance of state report. Yeah. So Kansas City, Jackson County has its own. Yeah.
I'll give you my card.
But another comment was, in a school district that has 1,700 homeless identified children, the city has 55 of these family unification program vouchers. That's the problem. That is a problem.
I want to comment on the vouchers. It seems really simple to say there have to be more vouchers, except that in Kansas City, Missouri, the Housing Authority of Kansas City is currently only funded at 80% of their budget requirement to do their work. And so to say that they need to have more vouchers is true, but there are no simple answers to all of this. And I think the complexity of it is very much the thing that we miss as a community, because we have grown to be a community, a nation, that wants simple answers and wants them to be black and white answers. Homeless people are bad, they should get a job. It doesn't work that way. And I wish our public housing authority could give us 500 more vouchers. I don't know what the infinite supply would be. But to say that they have 55 is not to say that the Public Housing Authority in Kansas City says, this is what we need. They have as many budget issues as do not-for-profit agencies. And so it's just very simplistic to say housing authorities need more vouchers, because what they need is resources to fund those vouchers.
Oh, that's right.
And they're not the originators of their funding. That's Congress.
Right, exactly.
The point is, Congress is the funder, decides funding of availability of Section 8 vouchers and the Family Unification Program vouchers. This is not a local housing authority decision, it's a federal decision.
First of all, congrats on the PowerPoint with the bathtubs.
Yeah.
I need it. But, it's interesting just to say, I'm sure, I haven't seen this come out of some of the research, but if we look back at it from a public policy perspective, and this, I'm not, a social scientist or an analyst, so this is, I can say they're chronologically related. I can't say if they're positively related, but it's well related. So back in the day, when if you had a child, you had an income. There certainly may have been many problems that we still experience with our families, and every family experience, but you would have a roof over your head. So there's been a huge, and I don't imagine in the current political climate there would be much support for changing that. But the T in 10 is temporary, and most of us are seeing families who have timed out of 10. And the folks who have made it from the very good things in 10 would, quite frankly, probably have made it anyway, because extremely motivated. So that's a huge issue. Now, having said that, what you have already is compounding that was these, as you can tell, the problem you have with the bathtubs is they're not even in the same bathroom, which would not be good anyway, but they're on different floors. So that failure of folks to talk together. So because you didn't have to ask before 1997, do you have housing? No one since 1997, I'm just speaking broadly, has updated their assessment to say, oh, these families don't have a guaranteed income any longer of any kind. So perhaps we should ask about things like housing. So those are critical elements that wouldn't be that expensive.
Absolutely.
Yeah, so a call for coordination.
To look at welfare reform and say we need to quit talking about it. It's a shell game.
Yeah.
You have moved folks off of some kind of government role, that's what you want to call it, and they're now in HUD housing. So, and I'm not saying reading it too broadly, but that policy shift should really need to be considered.
Yeah.
And I think you have a break. the comments are reflecting the complexities in these issues. And added to that complexity is getting people at the same table, policymakers at the same table, to talk. And that's really what we're trying to do, and study ways that are effective to get people at the same table. So it's very well heard, yeah. Well, thank you very much. This was a pleasure.